Okay, thank you very much joining us at this meeting. I would like to invite Dr. Avesh Sheikh to recite Quran, so then we can formally start.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. Amen. May Allah Ta'ala guide us all to the true path of success. Amen.
Thank you very much, Dr. Avesh Sheikh, for your. I would like to invite Dr. Safi Afghan to present the project, which is Schizophrenia outreach project, Larkana. Safi Afghan is to you.
I would like to thank all friends and colleagues who have joined this. I have actually recorded this talk, which I will be playing. So bear with this. It's about 25 minutes. And thank you for your patience. And please raise your hands if you can hear the sound of the video. Just one or two, and then I will. Not this one, but when I play the video, please just raise your hands, and then I'll make sure that it's working properly. Bismillahirrahmanirrahim. In the name of Allah, the most gracious, merciful, and benevolent. I'm Dr. Safi Afghan. I'm a psychiatrist currently working as consultant in Walsall town, which is part of West Midlands. It gives me great pleasure. In fact, I'm very humbled to talk about Soul program with which I have been associated for over 10 years now. I'm really grateful to Sindh Doctors Association UK, which is my own charity organization. It's an organization of doctors residing in UK who belong to Sindh province, and they have been providing valuable services in the areas of health, education, and humanitarian assistance for over 4 decades now. I feel honored and humbled to talk about Soul program, which is very dear to my heart, and I have been associated with it for over 10 years. I understand that there are a lot of people in the audience who may not know the background to this program, so I will start with the basics. SOUL is an abbreviation for schizophrenia, which is a mental illness. Schizophrenia outreach in Larkana. Larkana is one of the major cities in Sindh province. Why and how this program was developed. I'll try to talk briefly on these
and then we'll come to the actual running of the program. As we have said before, there are stigmatizing and disabling mental health conditions, and schizophrenia is one of the key mental illnesses which affects individuals in that they lose contact with reality, they are insightless, they experience unusual thoughts, perceptions, and lead to abnormal and disturbed behaviors which affect not only themselves in the form of neglect or putting their lives at risk, but also sometimes in the form of aggression or violence towards others due to their delusional beliefs, and affects the whole family as well as the productivity in the economic terms. Schizophrenia affects nearly 1 to 2% of population throughout the world. However, its impact, its costs to the family and society are huge. And that's why it's important that if we treat one family member, it improves the productivity of the whole family as well as of the society. And the other important factor why we decided and considered to run this program is because government spendings on mental health is non-existent in most of the developing countries. Even in Pakistan, if you look at the psychiatric services and the psychiatrists, they are mostly congregated or clustered in large cities. The mainstream population, the common man, the poor, have no access to mental health care. On top of this, there is stigma, lack of education and awareness. So people who are affected with illnesses like schizophrenia, they are not taken to psychiatrists first. They are actually taken to faith healers or to shrines. And sometimes, or in fact, most of the times, they are subjected to maltreatment, human rights abuses, and persecution. Sometimes the family members themselves beat them or chain them. Now, this is the background why a program which is not just meant for treating those patients, but also educating the family members and also helping these people to become more productive individuals in the society. So there are three aspects to the program. The first is treatment of the illness. Second is educating the family so that they continue to support these individuals with treatment, which is often long term. And third is enabling them, empowering them to achieve maximum social recovery, i.e., getting into some type of employment or productive living. What actually happens in the SOUL program? I would like to acknowledge and give my tribute to my SOUL team in Larkana, which is headed by Professor Badr Junejo, with number of people. I will name the key people who have been running this program with dedication, with passion, and with commitment. They are Fayaz Sumro, who's currently running and working on the ground, Dr. Zulfikar Rahujo, Aurangzeb Junejo is our psychiatric nurse, and Mona is female psychiatric nurse, and Miss Muzanna Ali has recently joined our team as a clinical psychologist. How they deliver the program? There are nearly 200 patients currently registered to the program and scattered in the city of Larkana. The Soul program have got their own van in which they travel to about 5 or 6 homes every day, where they review the patients, they provide them 2 weekly treatments, and also speak to the family members about their progress. Some patients require injectable form of treatment, which is a depot injection, and some require combination of medicines that include injections and tablets. The psychiatrist in the team has overall responsibility to review their medication, and community nurses visit them more often and record progress notes. The psychiatrist also conducts routine outcomes, both clinically and their social functioning, which is then used to as a part of research within the program. The program has expanded. Initially, it was at the modest level. It was more of a pilot with nearly 30 patients. However, as the program showed promising results, and with the support and assistance from donors and our valued friends, both in Larkana and in United Kingdom, we have expanded the program to visible activity in the city of Larkana. The university has kindly provided this program a new building where we aim to host rehabilitation and other clinical activities. The Sindh government has recognized this program as a true community mental health service and have promised to launch community mental health service as a public health initiative on the lines of Soul program. And this is a great achievement, I would say. The treatment is not restricted to medication alone. In addition to treating patients' psychiatric symptoms, the Soul program also hold regular meetings. We call them family assemblies or family gatherings, where a select number of patients and their families are invited for an informal chat to get their feedback and also to support them with their socially and through education. Soul program has published a Sindhi booklet on schizophrenia, which is also provided to the family members and sometimes read out to them. The third aspect of the program is patients' social recovery, the empowerment, to enablement to contribute productively and constructively in the society. And SOUL has provided soft loans to a number of patients to enable them to start their businesses, sewing machines to the female patients to put themselves busy at homes and to improve their self-confidence. I look forward to your support. Even a penny, £5, £10, £15 a month pledge, or a lump sum of a yearly cost of one patient or two patients will go a long way in helping our cause, in sustaining our work, and expanding the number of patients we treat, and also provide stimulus to other colleagues who would like to start similar programs in their areas in Pakistan or elsewhere. Thank you.
SOUL program, a home-based treatment program for schizophrenic patients operating in city of Larkana, covering more than 200 patients. Map of Larkana city, where various schizophrenic patients are residing. I am Dr. Fayaz Subro. I am visiting psychiatrist in SOUL program. We used to go in community where we visit 5 to 10 patients daily. We register and screen new patients. We do comprehensive history and assessment, take progressive notes, make rating scales quarterly. We need urgent financial support for the smooth running of the program, as average patient needs 3 to 10,000 rupees cost per month.
Assalamualaikum. My name is Mr. Jamil Abbasi. I am clinical psychologist in SOUL program, which is based in Larkana. So basically what we do, we provide psychological interventions that is based on 5 tests. We call them psychometry or psychological assessment battery. After that, when we conduct all tests, we give a feedback of a patient to the attendant that what kind of strengths and what kind of weaknesses the patient has. After that, when our psychiatrists treat them with medicines, after that they get their good mental health, we provide them psychotherapy. Psychotherapy is basically a treatment by our talking, in which we provide cognitive behavioral therapy, anger management, and many other psychometric techniques and solutions which we give to the patients for their betterment of health.
अस्सलामुअलैकुम, मेरा नाम औरंगजेब जुनेलो है। मैं SOUL प्रोग्राम में कम्युनिटी नर्स के मातहत काम करता हूँ। मैं इस इदारे में 11 साल से काम कर रहा हूँ। SOUL दुनिया का वाहिद इदारा है जिसमें स्किज़ोफ्रेनिया जैसे शदीद ज़हनी अमराज को घर बैठे इलाज दिया जाता है और दवाइयों के साथ साथ इस्लाह भी की जाती है। मैं घर घर में जाकर मरीज़ों की दवाइयों के साथ उनकी तबीयत के मुतालिक बातचीत भी करता हूँ और उन्हीं मरीज़ों, उनके घर वालों को मरीज़ के रोज़गार करने के बारे में भी समझाता हूँ कि वो फिर अपनी ज़िंदगी सही गुजार सकें।
अस्सलाम वालेकुम, मेरा नाम मोना कोलाची है। मैं SOUL प्रोग्राम में एज अ कम्युनिटी नर्स काम कर रही हूँ 5 साल से। और SOUL प्रोग्राम दुनिया भर में एक वाहिद तंजीम है जो स्किज़ोफ्रेनिया जैसे शदीद ज़हनी मरीजों को घर बैठे दवाएं मुहैया करती है और दवाओं के साथ साथ उनके घर वालों की इस्लाह भी करती है। मैं घरों में जाकर पेशेंट्स की फीडबैक लेती हूँ और उनके घर वालों को उन मरीजों के मुतालिक अवेयरनेस देती हूँ और मरीजों को काम की तरफ लाने में उनकी मदद भी करती हूँ।
उन करे थोड़ो उनके उन साइकोलॉजिकली हवाले सां डील न भी करे सके घर जे अंदर। सो हू थोड़ो इन तनाई जो शिकार थी हुई है। उन खां बाद में हूँ ट्रीटमेंट तक करायो मुख्तलिफ डॉक्टर्स का लाड़काना जे अंदर, लेकिन ॾिसां पियो कि मतलब हू फ़ाइदो कोन पियो थिए। पोइ उन जा कुछ रीजनिंग हुई, पोइ बाद में मूंखे ख़बर पई, मूंखे शुरू में ख़बर न पई, बाद में ख़बर पई कि बाबा असल चाही त उहा जेका जीअं हाणे साईं ज़िक्र कयो त उहा हिकिड़ी गैपिंग अची वई मेडिसिन जे अंदर, उहा प्रॉपर जेका उहा वठे कान पई ऐं इन्हनि खे बि डाज में रखे बि तव्हां मूं खाई छॾियो। अच्छा, सिम्टम्स जी ॻाल्हि हली त सिम्टम्स जे हवाले सां हू अक्सर इहा ॻाल्हियूं कंदियूं त मूंखे आवाज़ूं अचनि थियूं, आवाज़ूं अचनि थियूं। मुंहिंजे ख़्याल में उन डिज़ीज़ जो नालो शिज़ोफ्रेनिया कोई जी सर। तो मां पाण भी थोड़ो वरी जॾहिं इन शइ खे पढ़ियो नेट जे ज़रिए, कुछ बुक्स या कुछ दोस्तनि जे ज़रिए,
असां वटि उर्दू सिंधी में किताब जो बि छापियो आहे असां अवां काफ़ी वठी जो
थैंक्स। त सर इन हवाले सां मतलब पोइ इहे उन जा सिम्टम्स हुआ। अच्छा, घर में उनजो एटीट्यूड अजीबो ग़रीब थी वियो, विढ़ण लड़ण ही झगड़ो करणु माउ सां फादर सां, अहिड़ा अहिड़ा लफ़्ज़ कढणु, असीं ॾाढा मजबूर थी वियासीं। पोइ हिकिड़ी ॻाल्हि हिकिड़ी असांजे लाइ त मां त चवां थो कि हिकिड़ी अल्लाह ताला जी तरफ़ां हिकिड़ी रहमत हुई कि इहो ख़ुदा पाक जी हिकिड़ी रहमत ई असांजे मथां कि अल्लाह पाक असांखे हिकिड़ी अवेयरनेस ॾिनी, कंहिं फ़रिश्ते जे रूप में, कंहिं कहिड़े रूप में। अल्लाह ताला कुझु सोर्सिस पैदा कंदो आहे त पोइ ख़बर न पवंदी आहे। पोइ कंहिं अदी जे ज़रिए असां वटि इंफॉर्मेशन पहुती, हिकिड़ो प्रोजेक्ट हले पियो सोल नाले सां, तव्हां उन्हनि सां थोरो रुजू कयो। पोइ मां पर्सनली उन्हनि सां मिलियुमि बि, साईं वारनि सां, सिफियाल साहब वारा हुया ऐं पूरी टीम हुई। मां त केतिरो उन्हनि जो शुक्र अदा कया, उहो घटि आहे, मूं वटि लफ़्ज़ ई न आहिनि। सिधी ॻाल्हि आहे, साईं जुड़ेजो साहब वेठो आहे, साईं वगड़ साहब वेठो आहे, साईं जन आया आहिनि परे खां कई करे हिते। असां कंहिंजो शुक्रिया अदा कयूं। बहरहाल इन्हनि जूं लख थोरा आहिनि असांजे मथां, सभिनी दोस्तनि जे मथां, सभिनी माउरुनि भेनरुनि जे मथां, वॾनि जे मथां, कि हीअ असां हिकिड़े नयो यू टर्न वठी करे नई लाइफ में खणी आया। असां मायूस थी वियासीं, यकीनन डिसअपॉइंटेड हुई, एतिरा डिसअपॉइंटेड हुयासीं कि हाणे असां कयूं त कयूं छा, को तरीक़ो बि न आहे। ऐं हे मरीज़ जेको आहे सो मूंखे डॉक्टर्स ॿुधायो कि हिकिड़ो लॉन्ग टर्म मेडिकेशन थींदी आहे हिनजी। हाणे इहो बि वरी मसइलो हुयो। पोइ वरी हे वरी अल्लाह जी कुदरत अहिड़ी, ॾिसो हीअ असांजे मथां रब जा अहसान आहिनि कि डोर स्टेप ते अची करे उहे असांजे मरीज़ खे ॾिसनि। इन खां वधीक कहिड़ी ॻाल्हि थी सघे थी, ऐं बग़ैर कंहिं लालच लोभ जे। हाणे इन खां वधीक मां त नथो सम्झां कि मां चवां थो हीअ असांजे लाइ फ़रिश्ता आहिनि, फ़रिश्ता।
वेलकम बैक। पाकिस्तान में उन लोगों की कमी नहीं है जो खिदमत खल्क के जज्बे से सरशार होकर रज़ाकाराना तौर पर पाकिस्तानियों की मदद करते हैं, और इस मदद की बहुत ज़्यादा वक़्त है अगर वो पाकिस्तान के दूर दराज इलाकों में हो। अपने रमज़ान मुबारक के खुसूसी सेगमेंट में हम आपको दिखाएंगे लाड़काना का जिक्र हम करेंगे, जहाँ पर एक तंजीम है सोल स्किज़ोफ्रेनिया आउटरीच इन लाड़काना। ये नफ्सियाती मरीजों के लिए अपने आप को वक्फ कर देने वाली तंजीम है। डॉक्टर्स इसको चला रहे हैं, घर घर जाके नफ्सियाती मरीजों का इलाज करते हैं, बहुत ज़बरदस्त खिदमात सर अंजाम दे रहे हैं। बेनज़ीर भुट्टो मेडिकल यूनिवर्सिटी के प्रोफेसर डॉक्टर बदरुद्दीन जुनेजो और बरतानिया में मुकीम पाकिस्तानी जनाब डॉक्टर सफ़ी अफगान ये बेशबा खिदमात सर अंजाम दे रहे हैं सोल के तहत। हम आपको दिखाते हैं अपने नुमाइंदे खुसूसी इख्तियार खोकर की ये रिपोर्ट।
ये बीमारी जो है वो एक ऐसी ज़हनी बीमारी है जिसको हम शदीद ज़हनी बीमारी कहते हैं, जिसमें मरीज़ जो है घर में वो उसको जंजीरें भी बांध देते हैं, कभी कभार उसकी मार पिटाई करते हैं, क्योंकि वो समझते हैं कि ये बीमारी नहीं है, कुछ और है, जैसे कि कोई तावीज़ है, कोई जिन है, भूत है। तो वो इधर उधर के उस पे मकामात पे लेके जाते हैं, कहीं छोड़ के आ जाते हैं। उससे ज़्यादा बीमारी जो है ना वो बिगड़ती है। हमने इस तरह से सोचा कि एक प्रोफेसर है हमारे यूके में, बरतानिया में, वो यहाँ का पाकिस्तानी है, प्रोफेसर सफ़ी अफगान। उससे मेरी बात हुई थी, उसने कहा कि इस तरह के मरीज़ हैं तो उनको हम क्यों ना घर में जाके उनको इलाज की सहूलत मुहैया करें। मैंने कहा ठीक है। پھر ہم نے یہ کوئی 2011 میں ہم نے ایک ٹیم بنائی چھوٹی سی، اور لوگوں تک ہم گھروں میں پہنچے. ان کو جب مفت میں علاج کی سہولت ملی اور ان پیشنٹس کو جیسے ہم نے کہا ویسے انہوں نے ان کو دوائی کھلائی باقاعدہ، تو وہ کوئی 3 مہینے سے 6 مہینے تک ان کی علامات جو تھی وہ غائب ہو گئی. آپ کی طبیعت کیسی ہے؟ صحیح ہے. ہمیں جب یہ انکریجمنٹ ملی تو ہم نے کوشش کی کہ کیوں نہ اس کو تھوڑا سا بڑھایا جائے. 150 پیشنٹس ہمارے پاس رجسٹرڈ ہیں اس پروگرام میں، جس میں سے 35 خواتین ہیں. ڈفرینٹ محلے میں ہے، کوئی ایسا لمیٹیڈ شہر کا علاقہ نہیں ہے جہاں پہ ہمارے پیشنٹ ہیں. ہمارے
شہر کو کور کرتے ہیں،
پورے شہر کو کور کرتے ہیں. یہ آسانی کے لیے ہم نے بنایا ہے، سمجھنے کے لیے کہ بھائی یہ یہاں ہمارے پیشنٹس موجود ہیں. ان میں اتنی امپرومنٹ ابھی آ گئی ہے کیونکہ کافی عرصہ ہو گیا ہے کہ وہ کام کرنے کے قابل بھی ہو گئے ہیں. کچھ ان میں سے ہم نے یہ سوچا کہ کیوں نہ ان کو کام پہ لگایا جائے. چھوٹا موٹا قرضہ دے کے ہم نے ان کو، عورتوں کو سلائی مشینیں لے کر دی ہیں جو باقاعدہ چلا رہی ہیں، اور جو میل ہیں ان کو بھی ہم نے کچھ کام سے لگایا ہوا ہے، جیسے وہ ریڑھا لگاتے ہیں، کیبن ہے، کسی کی دکان ہے چھوٹی موٹی. ہمارے نالج کے مطابق یہ ایک واحد پروگرام ہے مینٹل النیس کے لیے جو کہ کسی کو گھر جا کے مفت میں علاج کی سہولت مہیا کی جا رہی ہے اور اس کے بعد اس کو ریہیبلیٹیٹ کیا جا رہا ہے.
پہلے سے اب بہتر ہے طبیعت میری.
اچھا جی، جو آپ جو کام کر رہے ہیں یہ کافی مشکل کام ہے، اس میں مسائل تو آپ کو درپیش آتے ہوں.
ریسورسز نہیں ہیں ہمارے پاس، چندہ دینے والے بہت کم لوگ ہیں ہمارے، جبکہ پیشنٹ بہت زیادہ ہیں. ابھی ویٹنگ لسٹ پہ اس لیے ڈبل پیشنٹس ہمارے پاس ہیں. اگر کوئی مخیر حضرات آگے آ جائیں یا گورنمنٹ آف سندھ آ جائے تو ہم ان کو یہ پروجیکٹ بڑھا کے اس کو وسیع کر سکتے ہیں.
Sir, if Dr. Badr Junaid is there, can
Yes,
I invite him to speak for
I
a
was
few minutes,
waiting for
please?
you to, So I would like to thank you very much, Dr. Safi Afghan, for that presentation. It was a very nice presentation. I would like to invite Dr. Badruddin Junejo to talk about, he's running the project in Larkana. So Dr. Badruddin Junejo, please unmute your mic, and if you have 1 minute, please, if you can tell us about this project.
Bismillahirrahmanirrahim. Assalamu alaikum. Are you hearing me?
Yes, sir.
Yes. Thank you very much. First of all, I would like to pay thanks to SDA.
Sorry, Sai, jo mic unmute kajo. Dr. Badruddin Junejo, please unmute your mic, please.
Sir, are you hearing now?
Yes, we can hear you.
Okay. I say what Dr. Safi Afghan narrated and left nothing. Actually, it is honor for us to run this program, and it is now we are more encouraged to continue this program in future. One thing I think Safi missed, that this is not only the service providing program, but it also have a research component, that we are evaluating our patients from time to time on some psychological scales. The improvement of the symptoms, and then next phase of the education, and in the end, that is the rehabilitation. All are evaluated on some scientific basis, that is the scales. And we will, inshallah, very soon publish some paper, research paper, because what I know, in this region, there is no such program for the mentally ill patients, especially the schizophrenia. And you know, if you belong to this country, that is the Pakistan, and especially the remote areas of the Sindh where we are serving, the stigma is there, and the beliefs of the people treating with these schizophrenic patients especially is that they all are at the dargah and some pir fakir vagara dhaga. So in this situation, it was very difficult for us initially to start this program. But now the results are such that we are now hopefully that we will continue the same. I again say thanks. I will not take your time. It is Ramadan. We have Aftari done, but still you are with the fasting. So thank you very much, sir. I have nothing to say, but it is more than the services which are being provided in this area. And I am again thankful to Professor Safi Afghan that he is very much keen and having some helping hand. And the one thing which I want to say, that we need some resources because we are limited, and we have raised so many funds here during COVID because we are not able to organize some meetings for donation or raising the funds. But still, we are not hopeless. And Sindh government have given some green signal, but it will be in future. I think it will be better. Thank you very much, sir, once again.
Thank you, Dr. Safi Afghan and Dr. Badruddin Junaid. I would like to ask one question, that how Sindh Doctor Association UK or all other colleagues they are joining this Zoom meeting, how they can help to expand this program to other districts of province Sindh, or what we say, or to the province, all the province in Pakistan.
It's a very good question. Fahad. The example of Seoul is that we had collaboration with the host team, which is in Larkana. So if there are committed health professionals in other districts, then we can work with them, and we can actually train them in Larkana for a couple of weeks to show them the technique and the framework of the program, and then they can start, and we can support them as well, and mentoring them, so they can actually initiate these things in other districts. And I think the showcasing this program itself will give immense incentive to other districts as well. Yeah. Can I clarify? And I have sent an email to you with a couple of documents. One of them was our European Psychiatric Association presentation, which had evaluation of our program. That was in 2019. So I would be grateful if you could show that on the screen at some point, or maybe share it with colleagues on the chat box. That document. That will be one of the useful ones.
Okay, I will open the floor for the participant. If anyone to ask any question, Dr. Safi Afghan and Dr. Badruddin Junaid to answer if you have any question or if you want to support. Shahid Qureshi, I can see you raise your hand. Dr. Safi Afghan, before I take Shahid the question, can you share the screen that is the last slide, the bank account? Shahid, can you unmute your mic, and if you can ask a question quickly because we are running out of time. We already 10 minutes over time.
Okay, thank you, Dr. Mehman. Actually, I don't have a question, but I would like to make a comment. First of all, it's a very commendable work that Professor Junejo and Safi Afghan are doing. I mean, I just want to reiterate what Safi said in the end. This is actually a very good service model that can be replicated into different districts. As Safi said, it's not a rocket science. You know, it requires people who are willing to run this kind of program in different districts can contact Safi and his team. I'm sure they and other colleagues will be more than happy to support. It's basically replicating the same work what Safi with Dr. Junejo is doing in Larkana. Exactly that way it has to be done into other districts as well. This is all I want to make a comment.
Thank you, Shahid. And I can see, I don't see a name, but it says iPhone. So
Dr. Mumtaz wanted to talk with the Dr. Safi. Assalamu alaikum, Dr. Saab. Is the Dr. Mumtaz Qureshi? Maybe you remember.
Yes, I definitely remember you, Dr. Mumtaz Saab.
Yes, thank you very much. I'm proud to say that what the work you are doing, mashallah, alhamdulillah, excellent work you're doing. And I am the president of Hounslow Rotary Club of UK. And this sort of the projects, what we are looking for international level. So our international branch, because you may be familiar with the Rotary Club, and they have a lot of funds and sources available. But thing is that if we can communicate between each other, and I will ask my international wings to coordinate, and maybe we can sponsor this sort of the program, because what I notice is starting in other places, you people need more help, even in Larkana, to establish the program properly. So this is what I'm going to suggest. Probably, I think you have my number and I have your number.
Sure.
You can communicate, but alhamdulillah, I'm proud of you and the thinking of the way we are working, or the SDA is working. Excellent job. Very good. We will be with you all the way. And personally, we will support you, but we will discuss. And I think if we involve international level, different, sources, that will help us. Thank you.
I'm grateful.
Thank you, Mumtaz
Dr.
Ali.
Mumtaz.
Thank you. Please, I would ask people to unmute your phones or mic. I would like to invite, and do not jump in queue, because there is a people on queue. I will give everybody a chance. So I don't see the name, but it says iPhone. If you can unmute your phone, mic, and then ask a question quickly, please. Okay, so Iqbal Naeem, can you unmute and can you ask your question? Iqbal Naeem.
Yeah, thank you very much. Assalamu alaikum, everybody.
Wa alaikum salam.
I actually, just like everybody else, Professor Safi Afghan and Professor Junejo and all your team, is a really commendable job and is remarkable. I do appreciate. Just so looking at back home, that how thin we are on the ground regarding sources, resources, and everything. But it is really a great work. I just want to ask that what sort of difficulties or challenges you faced yourself, or Dr. Junejo, anyone can answer that. What sort of challenges to begin with you had, and have you made like progress over the years, or you maintained very quickly this kind of functioning level and you're continuing with this?
Yeah, as I said, thank you so much, Iqbal. I'm so grateful for your participation. We initially started with a very humble, modest level. You know, we registered 30 patients. We had collected enough funds to support them for about 18 months. So we started with a very modest level, and we did have initial problems because there was a time when we felt that we may not sustain this work because it requires a lot of resources. But with the grace of God, I think we had some support from some individual donors who actually encouraged us. And I think it's a work of over 10 years. So I think initially when we started in 2011, we didn't have even a salary to pay to a doctor. But I think in three years time, we managed to hire and pay to a full-time doctor, and we had extra nurse on the in the program. So this is how that travel was hard, and there was challenges, but we had, with the grace of, I think it's God's blessings, and with the support of our friends in UK and locally, we managed to strengthen the program.
Thank you. I would like to ask President Sindh Doctor Association, Shabak Lashari, if you want to comment something, and then we quickly to move to.
Safi Saab, congratulations for the brilliant talk. My quick question is, there are two questions. What's your catchment area? Do you cover outside Larkana as well, like Larkana district, surrounding districts? And what's your expenditure per year?
Yes, answer to first question is that we are operating within the Larkana city, and we are not extending. We have not had resources to extend it outside, in the district or divisional level so far, because of the limited resources. And the second thing is the yearly our cost is coming up to something like 35 lakh rupees, which is 3.5 million. So that includes this large chunk of that goes into the patient medication, but also towards salaries and other costs, transportation costs. And some patients are more expensive in terms of their treatments. Some of the patients we have to receive treatment-resistant treatment-resistant schizophrenia, so their monthly cost goes up to about 15,000 rupees, as opposed to 5,000 rupees. So I think this is the situation now. But I think there's a role for expanding it to a divisional level if we get a little bit more resources, inshallah.
Thank you very much. I can see the Nasreen and Rabia Afghan and Babar Junejo, Ahmed Raja. They're saying thank you very much for Dr. Afghan work and this commendable work he's doing. Thank you very much, Dr. Afghan, for your work. And